Okay, I'd like to welcome everyone to the work session this evening. Just a reminder, what the work session is just an opportunity for the district to provide information to the board and for the board and district staff to have a discussion about that information. It's not a point for public comment yet. There are also no decisions that are ever made in a work session. So this is just this next piece of time for whatever that looks like, up to an hour and a half will be a discussion. So with that, I'll turn it over to Dr. Cordy.
Okay, thank you. Good evening. Thank you, Director Hecker. So for our work session this evening, as you know, the topic is Ready Schools, Safe Learners guidance, the 21-22 guidance that we have. Our team will be sharing with you just a lot of information and a little bit of the history related to RSSL, but mostly what we know now. And we also know that this has been ever changing for the course of the last 18 months, and even up until noon yesterday. And so there's information coming in all the time, and of course specifically and directly and in some ways indirectly related to case rates. And so we'll be talking about that this evening. Just a reminder about a work session. While we have a lot of information to share with you in order to help you make the most educated decision, hopefully next week on August 4th, around face coverings, physical distancing, and cohorts, we also want this. I mean, the purpose of a work session is to be able to engage in the conversation and to ask questions. And so while there's information presented, from the podium, please know to jump in and ask questions as we go along. And if there's a topic that we know is in an upcoming slide that we believe we'll be covering, then we'll share that with you. And then when we get to that point, if you still have further questions, please dig in deeper. That's encouraged. Director Adamson?
Yeah, just for clarity for those that are in the room and those that are watching at home, the plan here is for us to receive information tonight, to hear public comment this evening, but no decisions are being made this evening. Any decision will potentially be made next Wednesday, so that we have enough time for staff to implement and families to be able to be prepared. But the goal is to not make a decision this evening, just so that there's not confusion about why wasn't there a decision, that has been the plan from the beginning.
Yes, that is absolutely correct. There are two meetings that we've slated, if you will, to engage in this conversation, and so just a conversation tonight and an opportunity to talk about what we know, answer questions, and for the board to converse. So with that, I will turn the mic over to Mr. Rose, our Chief Operations Officer.
Thank you, Dr. Cordy, Vice Chair Hecker, members of the board. It's my pleasure to be here tonight, talk to you about Ready Schools, Safe Learners. We're going to cover a number of topics tonight, mostly what is Ready Schools, Safe Learners, or as we often refer to it, the RSSL. We're going to talk a little bit about the guidance provided to us related to the COVID pandemic, and then the review of stakeholder input that happened over the last few weeks, and then finally some next steps. Excuse me. As you may know, last summer, schools received their first version of the Ready Schools, Safe Learners guidance, which represents a collaboration between the Oregon Health Authority and the Oregon Department of Education. And it is intended to provide schools with clarity and best practices in order to prevent the spread of the COVID-19 virus in school settings while still tending to the academic, mental health, and social-emotional needs of students. The original version of this guidance came to us on June 30th. You can see we received a number of updates throughout the rest of the 2020-2021 school year. One major component of the guidance was the need for an operational blueprint for each school. And that was intended to show how we would comply with the guidance requirements. Throughout the 21-20 school years, the updates came, and those were typically in response to changes in case rates throughout the state or to align with executive orders from the state level. Each time the guidance was updated, schools were required to change their plans and update their operational blueprints to align with any changes in that guidance. This was, again, jointly developed by the Oregon Health Authority and the Oregon Department of Education, but really informed by the Center for Disease Control, the CDC, by their guidance. The newest version came to us, and this is the School Resiliency Framework on June 25th, and then it was revised again on July 22nd. It is smaller than the previous versions of the Ready School Safe Learners, but it will require an operational plan to be completed, so that way we can receive ESSER 3 funds, and I'll get to ESSER 3 in a moment what that is. And then many of the previously required strategies, for example, social distancing, are now advisory and have become a decision for the local level. And so there's a few of those that we'll be addressing with you this evening that Dr. Cordy mentioned a moment ago. Within the current guidance from OHA and ODE, there are a number of recommended and required items. The next 3 slides are going to kind of show you what those are, starting with what is required and frankly not negotiable, as well as those items that we have implemented, and finally those items that are pending board decisions. For required items, we must submit a plan to fulfill the requirements of the American Rescue Plan. This is part of the Federal Elementary and Secondary Schools Emergency Relief Act, or ESSER 3 as we commonly refer to it. If we do not submit a plan, we are not able to receive about $1.1 million in funding. And this new plan replaces the old operational blueprints that some of you may be familiar with from the 2021 school year. We must also create a communicable disease plan that includes measures to limit the spread of COVID-19, a requirement to exclude staff and students from schools suspected of having been exposed to COVID-19, and to make space for isolation and care of sick students. We must create, or in our case, continue to use isolation and quarantine protocols as we work with our local public health authority to establish who is exposed and follow their determination of what is an exposure and determine how to proceed. And finally, we must require students and staff to wear masks on buses per federal mandates. These items are clear-cut and already implemented. For ventilation airflow, we have increased the amount of fresh air from the outside introduced into our systems. We exhaust air from inside to the outdoors, and we are cleaning that air with the highest level of filtration that our systems will allow to remove as much of the as much of the virus containing particles from the air that we can. Hand hygiene remains a focus, and we have provided hand sanitizer throughout our buildings. And then the school resiliency framework suggests equity should inform every decision. And as with all of our decision making, we will utilize our equity lens to do so. Another key recommendation is providing time and space to student and staff to tend to student and staff mental health and well-being. Now, these are the items that, after we provide further information in the next slides, are pending board input and decisions. Specifically, we have 3 questions. What will we require related to masks in school? What physical distancing measures will we implement? And finally, what cohorting requirements will we make? And we are holding space at the end of this presentation to discuss these items specifically. As I mentioned earlier, the School Resiliency Framework is based on the guidance from the Center for Disease Control and Prevention. This most recent guidance was released on July 9th, with the mask recommendations being updated just yesterday. The new mask recommendation is that all staff, students, and visitors at schools wear masks regardless of vaccination status. The guidance also recommends 3 feet of physical distancing, contact tracing, and hand washing. So our local public health authority is actually the Washington County Public Health. Their role is to inform our response to positive cases and quarantining needs. Our school nurses work directly with Washington County Public Health on the response to each positive COVID-19 case in our district to ensure that our response is in line with their requirements. These are their recommendations as of July 13th. Continuing face mask coverings for schools serving children under 12, mandatory face coverings for unvaccinated students and staff for schools serving children 12 and up, and then optional face coverings when outdoors. Again, these are their recommendations. I won't read all of them for you. Understandably so, this topic raises questions related to the district's liability and insurance coverage. We purchase our insurance from the Property and Casualty Coverage for Education group that you heard about in our earlier work session. It's commonly referred to as PACE. Our policy has a communicable disease exclusion, so we have no coverage under PACE for any liability related to COVID-19 exposure. In addition, though, PACE has set aside minimal and limited funds to defend districts in the event of a lawsuit. So there's a small amount of money that if we were to be sued, they would put towards our defense, not necessarily our cost towards any kind of liability. As a public agency, we cannot purchase insurance directly, but we must go through a broker. In our case, we use Brown & Brown, and they work on our behalf to acquire the appropriate and needed insurance coverage. In a conversation with Brown & Brown on the 15th of this month, I was given the PACE recommendation of stay in line with the Oregon Department of Education and Oregon Health Authority from a defendability and liability perspective. In other words, they're saying follow ODE and OHA guidelines to limit our exposure to liability concerns to the extent we can. And then failure to do this would put the district at considerable financial risk. So what are the districts around us doing? As of Monday, so things could have changed in the last 48 hours, but as of Monday, these were the plans for our neighboring and peer districts. As was shared in the news, the Lake Oswego draft plan includes requiring face coverings for all students under 12 and recommends face coverings for those 12 and older who are not vaccinated. At a board meeting earlier this month, Newburgh removed the mask mandate for the 21-22 school year. And then Westland Wilsonville is strongly advising face coverings. They plan to physical distance to the extent possible, and they will continue to use classroom cohorts at the primary schools. And then Tigard, Tualatin, Beaverton, Hillsborough, Forest Grove, North Clackamas, in looking at their plans, they're still finalizing those and they're not yet published. And with that, I am going to hand off to my colleague, Christine Andrig, to talk about stakeholder input.
Hello, members of the board and Superintendent Cordy. Thank you for your time this evening. So last week, we began to gather input from our stakeholders, which include parents, students, and with a new tool called Thought Exchange. And this tool allows respondents to both submit original thoughts as well as respond to the submissions of other participants. After 2 days, we received multiple complaints regarding inappropriate content or misinformation. And as a result, we moved towards a more structured feedback survey. One of the concerns that has been shared with us about the stakeholder feedback process is the ability for feedback tools to be shared publicly and the potential for individuals outside of our school community to submit input through misidentification and swaying the results by doing so. This is a possibility with any online tool used for stakeholder input. And we cannot prevent recipients from sharing any public tools or from misidentifying themselves or providing dishonest responses. However, to help screen what we could, we did include demographic screening questions to help identify and potentially screen out those individuals who are not part of our SSD community. And we also provided open-ended questions in both tools where we could get added context behind answers, where people could, share firsthand, as a student, I feel this, or in my classroom as a teacher. And that helps to provide some context for those answers that we're getting as well. Because we know that these types of feedback surveys are not a perfect science, The intention of engaging stakeholder input in this way is to provide additional information to you as the board in your decision-making process rather than being a sole determinant factor. And it's also to allow as many voices in our community as possible to share their perspectives and input with our district and you as the board. While we did close the thought exchange tool sooner than expected, the submissions received did provide some important insights into the areas of concern within our SSD community. And the full extent of those submissions was shared with you, the board, last week in an email. For example, several of the top ranked comments of priority focused on students being able to return full-time in person this year, which our district has committed to and is in alignment with our current Ready Schools Safe Learners guidance. Many comments discuss the relationship between health strategies and the impacts that that has on social emotional well-being and academics for students. Additionally, we heard concerns about quarantine plans and a variety of perspectives on vaccinations. We also saw comments that weren't related to the health advisory prompt. Additionally, out of 615 submitted comments, 365 discussed masks or face coverings. Among those, approximately 31.8% were in favor of an optional approach to face coverings. 23% were directly opposed to masks. 28.5% wanted some level of mask use to continue in schools. And then an additional 7.7% indicated that they were in favor of the use of masks if it ensured full-time in-person instruction in the coming school year. There were additional comments, but they were more ambiguous in their position on masks. However, there was a theme of curiosity about having clarity of a plan prior to the start of the school year on the topic of masks. Feedback such as this demonstrates that, similar to what we've seen kind of all along the way in our stakeholder engagement, we have a spectrum of various perspectives in our community related to COVID health strategies, and this continues to be represented in this most recent data. Our follow-up survey was released and was specific to questions on masks and physical distancing, and that survey remains open as of today. As of this morning, we had received 1,563 responses. As you can see from the percentages here of demographics, the largest number of responses came from Sherwood School District parents. As is always the case, we do have some staff members that are both parents of children in the district as well as staff members, and we allowed them to identify that dual role as such, as we have been asked by them to in the past. And so that last percentage that you see, that 4.6%, represents an additional percentage above and beyond for both the parent and the staff groups. In the next few slides, I'm going to be sharing with you some initial findings of the most recent survey. However, please note that because this survey continues to remain open and we have such a large amount of qualitative data from the open-ended questions, we are continuing to review that, and we will be sharing more updates on that with you next week on August 4th. So first, for our parent group, we had 57.7% of respondents had students in grades pre-K through 5. 41.4% had students in middle school. 46.5% had students in high school. It's important to note that these percentages do add up to more than 100% because parents were able to indicate if they had students across multiple grade levels. Here you can see the responses to date as of this morning related to the preferences for mask use for students indoors. And I'll give you a moment to review those numbers. Okay, moving on. So the next question. This one was specifically related to face or mask covering use for teachers and other staff indoors. You'll note, I apologize, the question got a little bit cut off, coughing the graph over from the survey. So what that question read in its entirety in that second part is the district will continue to follow its current policy of no masks when outdoors or when students are not on campus. So we just wanted to clarify in the survey that this question is specific to the use of masks indoors while students are present for staff. Parent responses on this question very closely aligned with the percentages we saw on the previous slide. When asked if vaccine availability influenced their response to the question on this slide, answers varied greatly, including both yes and no answers, and a variety of reasons for giving either a yes or no answer. Again, give you a moment to review that. Okay, moving on. So next we have our input responses from staff members. To clarify, these are staff members that only identify as staff members, not staff and parents. For our staff respondent group, 53.3% work with grades pre-K through 5, 27.4% work with the middle school level, 28.1% work with the high school, and 3.7% work at the district level and not directly with students on a regular basis. Again, you'll notice those percentages are over 100% because staff were able to indicate that in some cases they do work with multiple levels. Here you can see the responses to date regarding the preferences for student mask use indoors. As you can see from this chart, staff were more supportive of student use of masks indoors than our parent group, particularly at the elementary level. All right, and then here on the staff responses to mask requirements for staff indoors while students are present. Again, noting that outdoor policies or policy for when students are not on campus remains the same. Again, the support for mask policies at the elementary school remains higher on this question. However, the no responses in this category are slightly higher than the responses seen on the previous slide specific to student mask use. While the input given by staff about the relevance of vaccine availability showed similar variation as what we saw in the parent responses, a number of the comments discussed the lack of availability for vaccines of students under the age of 12, as well as noted the availability that staff have already had to access their own vaccines. And I think those comments kind of represent the numbers that we see here. Okay, moving on. So this is representative of the responses of that specific group of staff that also have children in the district. Within this group of respondents, 58.3% work with elementary students, 23.6% work with middle school students, 25% work with high school students, and 6.9% work at the district level. Additionally, within this group, 40% were parents of elementary school students, 41.7% were parents of middle school students, and 55.6% were parents of high school students. As with the other parent and staff groups, this group had the ability to note either working with grades at multiple levels or having their own children in grades at multiple levels. Within this group, support for students wearing masks indoors at any grade level was a higher percentage than the parent-only group, but was a lower percentage than the staff-only group, kind of falling universally in the middle of those percentages. That trend was repeated in response to the requirements for staff to wear masks indoors. Again, kind of falling right in between the parent-only group and the staff-only group. Their input on the influence of vaccine availability showed the same wide variation of responses with both yes and no answers that was seen in the parent-only response group. Okay, moving on. Did gather input from our students. 72.5 respondents were high school students, 21.6% were middle school students, and 5.9% were elementary school students. The student respondents showed the lowest support for mask requirements across all groups, both for students as well as staff members, as you will see on the next slide. Student response related to the influence of vaccine availability showed the same variation as all other groups. However, there were several responses within this group specifically discussing the difference in availability between older students and younger students. So as I noted previously, this survey does remain open. So we will continue collecting results. We will likely close this survey by end of business day on Monday. But we're going to continue to evaluate both these numbers as well as all of those qualitative open-ended question responses. And we're bringing that update to you again next week on August 4th. So looking at next steps, as I mentioned, we'll continue to gather that input, coming to our August 4th board meeting to share that information. And then that evening, as an action item, hopefully moving forward with some guidance decisions on the topics of masking, physical distancing, and cohorting. Following the decisions made, we will be communicating our plans for the 2021-22 school year to our families and staff, as well as students, and getting our plan to ODE by the August 23rd deadline to ensure that we can receive our ESSER funding going forward. And with that, we open this up to board discussion.
I'll let you sit down first. I think there were a couple times that you mentioned ESSER funding. Could you go into a little bit more about what that is?
Certainly. The federal government has passed on 3 occasions various amounts of funding to support basically education and to cover the cost of COVID-19 and the impacts it's had on us. The most recent being the ESSER 3 amount. Each amount has gone up. And so this most recent amount for us is a little bit over $1.1 million.
Okay, we'll open it up. Other questions for the district? Comments?
I can start. Well, the first thing that I want to point out is that we all need to recognize that students' voices matter. I think there's been a whole year of both parents and students alike feeling like their voices didn't matter. And that survey was very telling from both parents and from, most importantly, our students as to what they want and what they expect from us. Because I like to come prepared, I just made some notes that I would like to touch on in regards to the mask decision. One thing that was noted at the very beginning was that all of our decisions should be made from an equity stance. So on that note, I personally don't feel that requiring masks of teachers or students is an equitable decision. Many cannot wear for a variety of reasons, including asthma, disabilities. These kids, teachers, and staff need to be considered when we're making this decision. We've already decided that there's going to be no online option for school next year. When we are looking at the situation where some teachers, some staff, and most importantly, many students are not able to wear masks for a variety of these reasons, what is going to be their option for education at that point? Additionally, adding to the fact that this would not be an equitable decision is that many cannot afford the type of masks and the amount of masks that would be required to make this even a little bit safe for those wearing them all day long in this setting. There's been studies that have been done where they have taken masks and tested what is on the mask after prolonged use. You've got pneumonia, strep, tuberculosis, am I saying that right? Meningitis, E. coli, Lyme disease, sepsis, and also just as troubling, if not the most troubling, bacteria that causes staph infections. You get those in your lungs and you are facing big problems. Additionally, our kids really deserve the highest quality education that they can get in Sherwood School District. And that comes from communication. You can't teach without proper communication. 80% of communication is nonverbal. We would be depriving kids of proper development of socialization skills if we were to require them to wear masks in schools. In addition, for the teachers, wearing a mask makes it hard to teach. Teachers can't read the facial expressions of their students to see if they're absorbing the information that they're teaching them. And many kids who are already scared to raise their hand and ask a question are even more so when their face is covered and they feel essentially muted. I understand what the CDC is recommending. In my personal opinion, the CDC has lost quite a bit of credibility for me personally, as far as their recommendations go. So many other countries have removed their mask mandates and actually seen improvements in cases. It's been noted in many, many different studies that wearing masks actually can make you sicker because you're breathing in your own carbon dioxide, you're not allowing your immune system to work. So if we're concerned about being sick in school, we're concerned about outbreaks in school, we need to take these things into consideration that this will be, on many levels, more detrimental. On the CDC's own website, it does state that 85% of those who got affected with COVID over the past year classified themselves as regular mask wearers. 70% said that they always wore a mask, and 14% said that they often wore a mask. The bottom line is this is a personal health decision, and we're a school district. We should not be forcing medical treatment on anybody coming into our schools. I believe the response from the community is clear. The evidence supporting no masks is clear. It's a personal decision. We should absolutely welcome anybody who decides to want to wear a mask. They should wear a mask. Those who don't should not be forced to do so. That's all I have to say.
Anybody else? Duncan, go ahead.
Yes, just prepared a statement here. It is not okay to do this to kids. Kids' automated systems of biology are learning to recognize smiles and other social cues during childhood. Depriving kids of that learning for years will impact human physiology that lasts for more than a generation. Before the CDC announces anything else, they should be required to show hard data about why this is necessary for kids, and they should be required to specify what conditions will cause the end of the orders. Because I said so is not enough for a mother talking to her young kids. It's not enough for unelected government agencies messing with our kids' mental and emotional wellness. As always, we all want to be safe. We all want to be free. Where do we draw the line between those two defines how happy we will be.
Thank you. Dr. Adamson?
Yeah, thank you. I do have a question. You had mentioned a few things that we were going to continue to monitor up until next week's meeting. I assume that we'll continue to monitor whether there are any changes in guidance from the CDC, OHA, or the local public health agency as well.
Yes, that is correct. If there are any other guidance updates, we'll make sure to include that when we come back to present the information next week.
Okay, great. I think that's really important. So I have, as I'm sure is not a surprise, a little bit of a different perspective. I've got a lot of respect for everyone on this board and the different perspectives that we bring. And I think that's really important and healthy for us to be able to bring these issues, each with our own lens, and be able to have a civilized conversation about this issue. Over the last few weeks, I've watched a few other boards tackle this conversation. And I really am grateful for my colleagues on this dais and our ability to have that in a civil and frank way, and to share divergent viewpoints without it devolving into something else. So I just want to start with that. I think that's part of what makes Sherwood different, part of what makes us great, and something I just remain really committed to. I think, as some may know, I work for a health system in my private life. And so I come at this with a different view, and with full acknowledgement that I am not a public health expert. I'm not a healthcare expert. I do work for a health system, but I'm not a doctor. I'm not a nurse. and I'm not a public health agency personnel. So I think there are, we are all informed by this, because you can't turn on the news or look at a paper or go online without coming across studies and opinions and a lot of different ways of looking at this issue. I think what, as I look at decision making on this, one of the key pieces is what our public health agencies are telling us. Their sole goal is to stop this pandemic and try and find ways to help us mitigate it. And so to me, what our public health agencies have to say is really important, because they have taken all of the things, all of the studies, all of the good, all of the bad, weighed those in the balance and have the expertise to do so, and then made recommendations. And I think we ought to listen to them. I also think we ought to listen to the families in our district, and that we ought to make sure that we're listening to all voices. As we've been told by our public information officer, these surveys are a sense of the community. I read each and every comment submitted through Thought Exchange. That was 97 pages of comments. And I appreciated the time that each and every Sherwood citizen took to weigh in and to share their perspective, because I think that makes us stronger. But as we make these decisions, there are multiple factors that I want to continue to look at. What do our public health agencies continue to say to us? What is viable from a implementation standpoint? What are the ways that we can make sure that we are keeping people safe and healthy? And then certainly top of mind for me is, how do we make a positive school environment where we are able to keep kids in school? Because to me, one of the most important things is, how do we avoid having outbreaks or quarantining being necessary, and then a really disruptive school year, given that we don't want to see an entire class of kids have to stay home for 2 weeks and then come back and ping pong back and forth. I think that, to me, we need to try and employ strategies that will prevent that from occurring. So as I really looked at some of the comments that I saw, and one of the things that we didn't list on the website, or list on the PowerPoint as things that we're going to decide on, but that we clearly heard from the community they're concerned about, are vaccines and frankly, vaccine mandates. I want to share that personally, I think if you can get vaccinated, you should get vaccinated. I recognize that those under the age of 12 are not eligible for vaccination. But all of that said, that is my personal opinion. That is not, I don't believe that school districts should be making decisions about vaccine mandates. If there's respectfully, I'd ask that we don't clap. That's not what this part is for. I appreciate that you're excited about that, and I can understand that. I believe that if the state wants to mandate vaccines, there is a process for doing that, but that it shouldn't be done at a school district level. That's just not an appropriate place for us to be. I do want to see this district. So I do think that we should take a decision on that, so that I think the community really wants to know, are we going to require that or not? And so I'd really like to see us next week be very clear about whether we're going to mandate vaccines, because I think that is a point of high stress for this community. I personally don't think that we should, but I think that's something we should discuss as a board and send a very clear message to the community so they know what to expect from us. And again, I believe that if that happens, that should be at the state level, and they've got a process for that. I don't believe individual districts should. I do think that when we think about social distancing and cohorting, my preference is to try and enable, especially in the upper grades, kids to take as wide a berth of classes as possible. We really worked at that last year to try and keep as many options on the table for students to pursue individual passions, and for kids to be able to take a range of CTE and music and art and whatever it is that spoke to their soul. And I would like us to, as we think about social distancing and cohorting, that we keep that as a priority, that we do those to the extent that we're able to enable students to have choice and families to make those decisions. I think that's really important. And I think that when we think about physical distancing, I think it's important to try and do that as much as possible, but not forego things like labs or experiences where you're in shop or whatever it is and you need to be closer together. All of those things, which are important measures to try and prevent virus, then leave us to the last question of masks. And for those of you that cheered me earlier, you may not be as excited about what I have to say now. I really believe we've got kids in K through 6 who are not able to be vaccinated. And being in school all day is different than going to the grocery store. It just is. You're spending a lot of time next to other people, and our public health agencies have said, wear masks. And I think until, I don't want this to go on forever, because I think that once people have had the opportunity to be vaccinated, you should get vaccinated. And then at some point in time, you're making a choice to continue not to be vaccinated. So I would like to hear from the district the feasibility of looking at under the age of 12 vaccination requirement until a vaccine is available for that population, and then a run out period of 8 weeks. So if Pfizer goes first, that allows 2 doses for those that get vaccinated within the 3 weeks, and then full immunity period of time, which would take 8 weeks. And then we could advertise the end of it unless otherwise required by state or federal mandate. I really feel like that is an option that will enable that cohort, and for the teachers that are around them that may or may not be able to get vaccinated due to immunocompromisation, and other kids that are potentially immunocompromised. I think that that's it. From my perspective, it's a fair balance. I'd like to hear about whether or not that's feasible from an implementation standpoint or the complications. But I think it gives us a chance to really consider, how do we provide protection for those that cannot get a vaccine? How do we do it on a period of time where folks know once a vaccine's available that that requirement will go away, so that that's not a recurring debate at this board? I'd also like, as part of that, I would also offer that I think that it would be important that if CDC or OHA or others believe or issue guidance that mask wearing is harmful or is no longer recommended for that term, that we then remove the mask wearing requirement. I believe mask wearing is safe because our public health agencies tell us so. I understand that that is not a universally held opinion in this community or on this board, and that's okay. It's okay for us to have different views. I also think that I think we ought to hold open the opportunity that if we hear from public health agencies that they, on the evidence and the data, now view it as unsafe, that we change our practices, and that that's an automatic thing that occurs as opposed to a new debate at this board. So those are things that are weighing on my mind. Last and certainly not least, and I appreciate Director Thorne raising this issue. I believe strongly that children should be able to, in grades other than K through what would end up being 6, or kids over the age of 12, that students and staff should be able to make the decision on whether to wear a mask. That they should not be bullied for that decision. They should not be made to feel other, whether they wear one or not. I think that that's very important, that we, in those older grades, allow for those choices, and that we don't tolerate behavior that would make people feel othered or otherwise feel bullied for that decision. And I say that not because I believe any adult or student would want to do that, but I know that emotions run really high around this topic. And I think we need to be very clear as a community that we're going to be accepting of people that have a different perspective. And and we're not going to tolerate behavior that's any different than that. So I apologize for the amount of time I took, but I really wanted to share all of those thoughts with my board members and fellow board members of kind of where I'm at and where the community, after kind of weighing all of this and some sleepless nights about this issue, really kind of where I think there might be able to be some middle ground that incorporates a wide variety of perspectives in this community.
Thank you. Dr. Hawkins, any comments?
I do have just one comment, very short compared to what you had to say, but no, it's great. Sitting on the board and being somebody who wanted to represent parents and kids in this community and looking at the data that we had tonight, that's all we really have to go off of as board members. And it's hard for me to look at the data and not know in the back of my mind that that's just a small snapshot of our community and that people can sign in and take it as many times as they want. You know, it's not a secure study, as you acknowledged. So I guess it just weighs heavy with me that we try to base our information as far as what the community wants off of that small snapshot, because that's not everybody's voice. The other thing that wasn't in the survey, which I wish we could acknowledge, is I've talked to kids, a lot of kids, who've said, like, if I had to remove one thing, masks or cohorting, which would it be? If I couldn't get rid of both, which would it be? And so I'm curious to hear kids' responses, because personally, I don't really want my kids to go to school in a mask, but I'm willing to do what they're required to do to send them to school. And that's my own personal belief. But if I asked my kids, they'd say, I don't want to be stuck in a cohort. I'd rather wear a mask. That's just what they would say. And I've talked to other high school kids who have said, I want to be at school in classes with my peers. I want to move around the building if I have to keep a mask. Now, that's just like a handful of kids that I have talked to. So obviously that's also not representative of our entire community. But I would have loved to have known that piece of information, because it may come down to having to make certain distinctions between we can do this, but then we maybe aren't able to do this. And so that's just a piece of information I wish we could get. And I would encourage community members to please go on and fill out the survey, because I think as many people as can, then we have a better, source of information, as long as you're doing it once. that's also really helpful. That's it.
Thank you. So I actually have a question for you. When we talked about the PACE insurance, so my understanding of what you showed up there was that there really isn't coverage for COVID-related issues. Is that correct?
That is correct. We do not have coverage through our general liability through PACE.
Okay, so then my next question would be, so it really doesn't matter from that perspective if we follow guidance or we don't follow guidance. We're kind of on our own to a degree. Is that a fair assessment?
The way it was described to me by our insurance broker is the more we stick to the guidance provided by CDC, OHA, and ODE, the more defensible our position is if we get to court. If we ignore the advice of those agencies, the public health agencies, our ability to defend ourselves goes down considerably.
I would personally like to see something from them that is more tangible, like in writing, as far as what their recommendations are for that. And I also have a response to that when they're talking about no coverage with COVID and us being, it being a liability basis. We also have to take into account that there's still liability regardless of what we do. If we mandate them, there's liability, right? Because you're also risking people getting sick from wearing the mask all day, from not having equal access to public education, which is what that will result in. Say we have kids come back to school full time, they're wearing masks all day, and these bacteria that we're finding on the masks tend to start causing other illnesses and other outbreaks. We're at liability there. So we really have to take into account all sides of this. And I would love to see more information from PACE or Brown and Brown in regards to that. So, and thank you also for mentioning the vaccine. I think that I'm in a full agreement with you. We should never, just like I don't feel like we should mandate medical anything, masks included. I obviously would agree on the mandates. And just in response to the kids K through 6 wearing the masks, I understood where you're coming from, but they're also then being put at a disadvantage because those are the kids that need those facial cues and that socialization the most. So we're really at a lose-lose there too for that. So.
The other question I had is really about guidance. So, we talk about, all of these recommendations right now are guidance. In the past, we've had things that were mandated. I mean, I've been sitting on this board through this entire pandemic and have been incredibly frustrated that I have yet to, in most cases, make a choice. The state would come in or whoever, we were told what we had to do with Ready Schools, Safe Learners. And I looked at that and I think it changed 9 times or something. It was nuts. And then, thank you CDC for your changes last night. That was spectacular. So I guess my question is, what would you explain as guidance at this point with where we are?
I'd probably go back to my slides and show the few things that are mandated in terms of like masks on buses. That's a federal requirement. We have no choice. But most everything else in the RSSL or now the school resiliency framework are, it's a local option as to what you do. They give you their advisory, not mandates, or recommendations, not mandates.
I'll try and use the microphone appropriately. I'll weigh in a little. I mean, I think with the CDC guidelines coming out yesterday, I mean, my big, wide awake at 2 a.m. was, oh my gosh, we're this close to being able to do something locally. And my fear is that the state's going to come in and change that for all of us. I certainly hope not. I've frankly had enough of that. I really appreciate all of the input. And as you can see, I think everyone up here, everyone in this room is incredibly passionate about this and no one wants to wear a mask. It's awful. It was so nice to get rid of that. But I also know there are a few things that I feel pretty strongly I don't want to do in this district. We don't want to be the vaccine police. We don't want to be the mask police. We don't want to make choices for everyone. I've definitely discovered that for me during this pandemic, I'm a pretty good rule follower, but it gets a little old being told what I can and can't do. And I think, we're getting to a point where I feel comfortable with people being able to make a choice for themselves and their own health. I want to be reasonable. The last thing I also want to do is to come back and have us be in a predicament where, oh my gosh, now we're quarantining, we're back to comprehensive distance learning. I certainly am cognizant of that possibility. But moving forward, I want to do what's best for kids. I don't think masks are great for anyone. I mean, I certainly miss seeing people, but I also respect that people should be able to wear a mask, like Jessica said, without being treated any differently. And as an example, at 8th grade promotion last summer, it was great to see there were several kids outdoors that still wore a mask, and I didn't see anyone having an issue with that. So I think it can happen. So those are just some of my thoughts as we move forward. I really do hope that we can make a decision that is Sherwood, that isn't the state of Oregon, that isn't CDC, that fits our community. So I'm thankful for that and a robust discussion, and I'm sure we'll hear more about it tonight. So any other comments? Yep.
Just one question in regards to because I understand liability is obviously something that we all need to be paying attention to. I mean, our insurance, without insurance, you can't do much. So when it comes to the advice from Pace and Brown & Brown, in regards to coverage versus no coverage, could the district maybe discuss the possibility of some sort of waiver between enrolled students and the district in regards to what the district isn't? Because when you go back to pre-COVID, okay, kids got sick in school all the time. You have the flu, you had all kinds of communicable diseases, sicknesses all the time, and nobody blamed the school. This is, in my opinion, in the same book as that. And so if that's a concern, I think it would be worth exploring that. That's coming from my insurance brain. I work in insurance, so I'm always going to go there. So I understand and appreciate the input on that.
Can I ask a clarifying question, just so I understand your input? Are you suggesting that we have staff and or students sign a waiver if they're not vaccinated and don't want to wear a mask, that they will not hold the district liable for any illness that they might incur?
I'm suggesting an all-encompassing waiver. I don't think it should be vaccinated or unvaccinated. I think that we're in a period of time where things are changing by the day. And if we are in a position that we need to make a decision that's best for our district so we continue to operate and keep kids in school, that we look into that as far as an insurability standpoint. It's worth asking and looking into.
I think it's an interesting point. I think other districts have entertained that possibility, and maybe it works. I think part of the challenge with having a waiver is, again, we would kind of become the waiver police. And what do we do if someone doesn't sign the waiver? Does their kid get to come on campus or not? I mean, I'm looking at this, and we really don't have insurance either way, right? We're really not covered for this. So, you know, I just don't really want to go down the waiver police way, just because I don't know. I mean, honestly, what do we do if someone doesn't want to sign it? Okay, now we don't have a cloud campus. You know, what does that look like? And I don't know how we would enforce it well. I do know other districts have considered it though. Yeah, exactly.
It's something we need to, I think it's worth exploring.
We'll look into it. We also have to recognize that we have to provide education to the students within our community. We don't have a choice. And so whether or not we're able to exclude based on whether or not a waiver's been signed, I think is something our legal counsel would definitely have to weigh in on.
Yeah,
But then
that was,
I'm sorry.
yeah, I was just going to say that's the point that I really want us to check on, is whether by requiring the signing of a waiver, are we creating a barrier to access to school that would then put funding or other federal us in arrears with that? So I think that's worth a quick call with council to find out, is there a structure, especially in a universal way as opposed to a more targeted way,
Right.
which is, I think, what other districts have discussed. In general, I worry about whether we could do that in a way where we ensure that people truly understand the consent that they're giving and the rights that they're giving up, and the impact to that. So I like the idea of trying to limit our liability as much as we possibly can, and
So
I
we
think
can
that
open for-
yeah, I
and
think
do no
that
masks.
so. Less concerned about that piece.
I know.
So you and I are on a different space
I
there.
know.
But I do think that there is, I think, Jim, I would be interested, as we're consulting with Brown and Brown about kind of getting that additional information, is there other mechanisms that they can imagine us to take that could help limit our liability beyond or in addition to maintaining as close as we can to CDC and OHA guidance.
Well, and I think one of the interesting things that comes to mind as you mentioned that is, this isn't just about masks. Ready School Safe Learners is also about trying to keep some physical distances. I mean, obviously, my goodness, just let's wash our hands. Let's have good hygiene. That makes a tremendous difference. We know we're going to have masks on the bus. So I do think, it doesn't just have to be the mask piece. If we're doing all these other things that make good common sense for just, disease in general, I think that's important too. I mean, obviously we would follow those protocols. I think that's already being done and will continue to be done, obviously, as well as cleaning protocols at the school and all of those other things. So I guess for me, there's more to it than just the masks and that type of liability. I mean, I honestly don't know what what liability would look like over masks or no masks. I mean, it's kind of interesting. Thankfully, I don't think we've really heard that coming up yet.
Yeah,
So-
I'm not really sure either. I did want to raise a couple other things. We talked about this last year, but I think it is worth reiterating in any communication to the community. This is a community-wide effort. And so, you know, again, no matter where we come down on the issue of masks, which I think is kind of the big issue at the table here, I do think that we need the community's cooperation as much as possible on things like, if your kid's sick, please keep them home. You know, those kinds of things are going to be really important, so that we can reduce the possibility of being in quarantine and what that looks like. The second and last comment for me here is I think we do also owe our community, and this may need to come later in the month, as I understand there's just a lot going on between now and next Wednesday. But I think we do need, and we do owe them an understanding of what it's going to look like if quarantining is necessary, and how that's going to work, and what that means for accessing classrooms, what that means for making up work. I mean, we're going to return to as much as normal, but if we're asking the community, if your kid's sick, keep them home, then we need to think about, are our policies for absences and for sickness going to cause anxiety? Because I think that's a very real thing. Kids go to school sick because they don't want to miss the test or because teachers are inflexible. So how do we as a school district really develop policies and a culture that doesn't create barriers for people to doing the right thing for keeping their kid home? Or if they're in a quarantine, how are we going to make sure people have access to that? And I think I'm sure that there are conversations going on, but I think more information that we can get out sooner on what that looks like, and mitigation measures related to quarantine. I think all of that's going to be really important so that people aren't surprised, and they can be prepared.
Any additional comments?
I just wanted to add that, I understand the liability issue. I read somewhere, we have about 10 to 15% of the world's population here in the United States, but we have around 90% of the world's lawyers. So we're an extremely litigious society. I understand that, but you got to ask yourself, do you want to live in fear of that? I feel like we owe it to our kids to be brave for them and make the right decisions that are best for them instead of worrying about what could happen. We need to make the right decision and not be fearful of those types of things. I know it's important, but at the same time, we're talking about kids. There's the liability from a monetary standpoint, but what about the liability that, as far as how this is impacting our kids and what we're doing to our kids? We're not talking about that liability. So I just want to keep that in mind.
Okay, any questions?
Sue, I just want to thank everybody for, again, a really kid-focused conversation and really respectful. I think, again, this really sets us apart from other districts. And I just am grateful for my colleagues, old and new.
Yeah, no, I would echo that. Again, we're all really passionate about how we feel, and nobody likes a pandemic. I'll pass on this ever happening again. But I think it's great to have these conversations, and there's so much to think about. And I really appreciate the work that the district has put in over and over and over. I don't know how many times we revised, pivoted, or had to change things, and that's been on the district. And, as that maybe wasn't obvious to the public, that was certainly always happening behind the scenes. And there's always been an effort to get kids back in school. I'm thrilled, like I think everyone else, to know that our students can come back to a full schedule, 5 days. And as Jessica mentioned, to have the choices and to participate and be together in a wide variety of classes is just going to be great. I can't wait to just, hear and see much more normal. I think we all look forward to that. And, as we move forward, I'm also really want everyone to know that, you know, we all respect one another on this board. And I would encourage, just as we've seen tonight, for everyone to speak their mind and to vote with their heart and their belief. And that's okay, because at the end of the day, we're going to come together with a decision on this board and in this community that we're going to go with in the fall. And whatever that decision looks like, I know that we'll come together and we'll support the kids and what we need to do. So thank you.
Sorry, one question. Thank you, Sue. Just to touch on what Director Adamson said about kids' access to school in the event that they are needing to quarantine. Because we're newer to this, I'm newer to this board, has the conversation begun about maybe what that looks like, kids having an online access of some format to that classroom in the event that they have to quarantine? Okay. So
We've started the conversation, but there's more work to do around
Okay.
that front and what it's going to look like. And the guidelines from ODE on what that looks like have actually changed since what they were under
right.
the old RSSL. And so, yeah. And so figuring out the best way to do that, and it will likely be different at every level, just with different capabilities of the kids and the way classrooms work and things like that.
Okay. Thank you.
Okay, with that, we're going to go ahead and adjourn the work session, and we will be back at 7 for the regular board meeting.